share this space with you all. I was just telling Mr. Sinclair and Mr. Glenn that it's just crazy how, life takes you in the journey, the successes, the failures and all that stuff, but it gets you to a place where you feel wholesome, and it's like a whole, full circle moment. Like Tanya mentioned, I am from St. Thomas. I'm a local. I went to Antilles, All Saints first, and Antilles, then went over to Hampton University for about a year when I graduated from Antilles, and then not that I wasn't a fan of Hampton, it just wasn't a good fit for me, and so I transferred over to Howard University. So I had both HUs, and they're like, which one's the better one? And like, they're both so great. And then shortly after that, did some interning over in New York City, because at one particular point, I swear I was going to work in the entertainment industry. I interned at BET, MTV, worked for a few celebrities in the interning world, and it just, all roads led back to St. Thomas. Let's just leave it that way. And I worked at ICMC, did some work there as their corporate concierge assistant. Lots of lessons learned there. They had the layoff. I was one of the first that was a part of that, but it's okay, because when one door closes, motherhood appears. So I got pregnant with my first child. He came just in the midst of the storms, Irma Maria, and all of that crazy stuff. But then came back home, and had another kid. And I'm a proud mom of two, Ace and Ayla, 6 and 8. They both attend Joseph Sibley Elementary School, which I'm just going to say I'm the PTA president there, so there's another hat that I wear in that regard. And yeah, back to the whole being a part of community and being well involved in the community. I did not know that was where the road was going to lead me, but you know that saying where it says you plan, God laughs, like that's literally what my life is, and I'm very grateful for it, because the work that I do with Patient Assist BI is very dear to my heart. What we do as an organization, as a nonprofit organization, is we help people who are uninsured and underinsured within our territory. So uninsured, when you don't have health care, and we started back in 2013 with a housewife, and her husband was one of the founders of the Red Hook Family Practice, and she basically found that there was a need in our community, right? If people are not eligible at Medicaid, then what do they do, right? So if you are diagnosed with a chronic illness, so that's diabetes, hypertension, high cholesterol, all of those things, and you have to maintain living with that disease, right? And here in St. Thomas, unfortunately, things are a little expensive, right? Our day-to-day lives with WAPA, rent, groceries, and then imagine if you have an illness and you don't have insurance. So then it's like you have to pick and choose. What do? You want to stay healthy, or you need to keep your lights on, you need to keep food in your fridge. And so Patient Assist BI comes in, and we basically take that burden off you, that stress. You just can have insurance, basically, if you're not eligible, and we pay for your maintenance prescription drug medication through our local pharmacies. We partner with 4 local pharmacies here on Island. So there's Drug Farm 2 behind the hospital in the Medical Foundation building. And then there's also the Medicine Shop. There's Chelsea on St. Thomas and St. John. And we basically have presence in all the private physicians' offices and all the physicians' offices, rather. And if the patient needs assistance, they are referred to us, and me and my team, we ensure that you get the medication you need to stay healthy and to, keep on being healthy. So that is for our uninsured patients. And recently we just launched an initiative for our underinsured patients, and that speaks specifically to our seniors. So if a senior is Medicare Part D, so there's Medicare A and Medicare Part B, There's the Part D, which is the drug prescription portion. And with that, although you think you're getting a lot of perks, at the beginning of every year, you have a huge deductible that you have to pay, right? Sometimes it's $500. Next year, it's going to be $615 that you have to pay in the beginning of the year. And you meet that deductible, and then you have your copays that you pay regularly. So we started this initiative back in 2004, last year, where we will pay half of the deductible for a Medicare Part D patient. So they would go to the pharmacy. I'll give you an example how it works. You go to the pharmacy and say, hey, I have Medicare Part D. I'm picking up my medication, and the pharmacy says, oh, well, you have a deductible that you have to meet of $615. They just make a phone call to us. We have our applications there, and we will pay up to 50% of that for them. And they're responsible for the balance. And then after that, we then give you $125 stipend towards your copays every month. So you can choose whether you want the 30-day supply, 60 or 90-day supply. And then we also will help in the coverage gap time as well, which usually hits between October and December. What we also do is that if you are on a more expensive medication, I'll give you an example. Eliquis, it's huge here in our territory, and there are big pharmacare assistance programs that if you are eligible and you meet their criteria, we partner with the physician and the patient to gather all the information necessary, and then we do all the admin work on the back end to ensure that they're eligible. And once that patient is eligible, they get their medication mailed here for free for up to a year. So we are a silent force. We are out in the community, but because we are a nonprofit that we solely do, or we seek donations through fundraising and grants and stuff of that nature, if we broadcast it, then I sometimes have to turn people away, and I don't like to do that because we have to try to stay within this thing called a budget, right? And to ensure that we can sustain as many people as we can. But over the past couple of years, I've done a pretty good job in securing hundreds and thousands of dollars of grants. But those can quickly dry out. So this giving season, between that October and December time, we're always, pushing out letters, reaching out to EDCs, reaching out to individuals that, if they hear about the cause, and, you can donate in that regard. So we have been working diligently on that, and that's everything about Patient Assist BI thus far. I'm grateful to be in that position because we help a lot of people. We like I said, we advertise, we do our thing, we're in the physicians' offices, but it would be great to help more. Right now we help over 118 patients that are currently enrolled. 86 of them are seniors, so we help pay for their deductibles. We do the 125. Some of the times we have to do the pharmacare applications for them, but we have a great system. It's myself and a patient advocate, and we work super hard to get the outreach out there and to ensure that we have a healthy Virgin Islands, one patient at a time. So far, do you guys have any questions?
Are you on both islands?
We are on St. Thomas and St. John. So the other pharmacy that we utilize is in St. John is Chelsea. I did some outreach over in St. Croix. When was it? We are in November. So in January, we did some outreach, and I've got 4 patients at Diamond Pharmacy in St. Croix that I'm helping. Okay. So we are trying to tap into companies and then, EDCs over there to see if they can give us support, so we can also extend slowly and hire just a small team over there to do all the work to ensure that all the patients get the help that they need. Yes, Mr. Sinclair.
I commend you for the work you're doing.
Yeah.
I'm very, very pleased. Have you ever reached out by sending a letter to us?
I haven't reached out and sent a letter, but I can definitely do so. I do have some letters. We have, donation tiers. In July, we had this, it's still ongoing, chronic illness Disease Month is in July, and the Chronic Illness Day, Awareness Day, is July 9th, and so we launched a campaign, which is pledge $30 to power 90 days of medication. So with the pharmacies that I mentioned, they give us a special price to give our patients who are enrolled a 90-day supply at a cost just to PAVI. So $30 can get a patient their metformin for 90 days, their, glipizide for 90 days, all of those things that they need. So we have tiers that we have on our website that people can go on PayPal and make their donations, whatever they feel, confident in what they're able to donate, for sure. Which, any questions so far? I can talk all day. But I like the website. It's www.patientassistvi.org. Yes.
And I can put that in the chat too.
And I can share all of this stuff.
Can you list your major sponsors and contributors?
So far there's a lot of EDCs. There's International Capital, well, I guess it's now IMB. So there's also First Bank. First Bank's a big sponsor. We have, some restaurants. St. Thomas Restaurant Group, they've been pretty solid. We have some doctors and physicians that are, constantly donating. But I'm being in the position that I am now, and I am trying to find more grassroots and more small businesses, right? Because every dollar adds up, right? Mm-hmm. So if someone has a business and you want to donate $250 or $500, everything, adds up and it goes to a great cause. And I like to be very transparent when I talk to groups because, nonprofits sometimes could be a little funky, right? They're like, where does the money really go to? And 90% in our history, between 85 and 90%, all of our funds to go directly to our patients, right? We also have CSVI, we are part of their Hodge grant that they help us specifically with our seniors. The ARPA for the federal, they gave us a grant for over $100,000 that we, have to spend, and federal dollars. So that was a really great one. There's this company that we were part of, a cohort that we were part of through Global Giving. I'm not sure if you guys know about this, but Global Giving, it's a platform for international nonprofits. And Jim Beam Co., which is Cruzan Rum, we were part of their disaster recovery cohort, and they've been gracious and was able to even let us start that initiative with helping with the co-pays and deductibles over the years. The testimonials, the thank yous, the gratitude that seniors have, and they're just like in disbelief that this is a service that's available to them. Because when the pharmacy is like, this lady, she really needs it, she needs her Eliquis or Jardiance, whatever, but she has to pay this astronomical amount of money before she can even get it, and we're just like, no, give her, she's eligible, you can give her, and she's grateful. Every little bit goes, because even with the copay portion, sometimes your copay is $40 or $3 and change, but for a senior who lives off of a fixed income, that can go to something else for them, right? So here at PAVI, we believe that healthcare should definitely be a right and not necessarily a privilege, and so that's what we pride ourselves on. We've been doing great work in the community. We try to get as much publicity as possible, but like I said, I don't want to go put it out there and then everybody comes knocking at the door and then I might have to start turning away because funds get a little funky, but that's what we do so far. Any other questions just yet before I move on?
Do you have an anti-fraud system? Because there are folks who they hear about this and they can afford it. They can find ways to scheme to keep their dollars in their pocket, but in fact they can.
Oh no, yeah, we have a whole eligibility criteria that you have to meet, and we work also with the physicians in the office, so at the doctor's offices and their admin, and we have a very close relationship. So if a patient comes in and it's like, oh, I can't, afford the medication, we have to look at the income, we provide statements, all of those things to so that we can wean out, because we've had those situations, right? But it's just kind of like, yeah, unfortunately, people do take advantage of it,
There'll always
and
be
then
somebody like
there's always somebody with a gimmick. Yeah, but we're able to weed those out, and we have a system in place for sure, an application, a screening process, and we have to go over it every year with our physicians just to make sure, yeah, this patient still doesn't have insurance, what have you, like what's their situation, and we do our follow-ups. But it's a lot of work on the back end, but we get it done. My team and I, we do a great job ensuring that, we don't getting scammed for sure.
You're in Run Club.
Yeah, so the other thing that I am a part of, that Miss Tanya told you guys about, is a run club. It's Rock City Run Club. I started my fitness journey maybe a couple years ago. Yeah, a couple years ago is when I started my fitness journey. After you have kids, some people aren't blessed with the genes to just make yourself look the way you looked before you had kids. And so there was a point where I was just like, okay, I need to get into something. And the founder of the Run Club, his name is Rain Chesterfield. He was just like, he started running, he started a fitness journey, and then some of us was like, yeah, let's just start running. And then it came from a group of like maybe 3 or 4 of us, and then now it's grown into a whole nonprofit where we give back to the community, put on races, give back to the community, and we meet Mondays and Wednesdays. Some people are very intimidated when they hear the word run club, but we welcome everybody to just, it's better to start now, preventative care, trying to be healthy, but you can walk. You can walk. We believe in the whole nobody gets left behind, so it's really great. We go and we invite everyone, all ages. Moms can bring a stroller. Some people that bring a stroller. And we just want the community to be more fit. We have a lot to live for, right? Some people have kids and you just want to live and feel good for yourself, right? That's what it's all about. So yeah, we meet Mondays and Wednesdays at Yacht Haven Grand at about 6 o'clock. We do the whole stretching, the whole 9, and then we do different routes. Mondays are more slow-paced days, and then Wednesdays we pick up the pace. But we give people the options. We give routes for people the options who just want to stroll and walk, catch themselves, and then you have the running portion too. But we always take a group picture at the very end. So that's why nobody gets left behind, to ensure that you are part of the group picture. It's really great. We have a whole social media page, and we're doing great things. We had the Carnival Shakeout. I don't know if you guys heard about it last year. It was really great. We put it out maybe 3 weeks before the date. It was right before the boat races, and we had 325 people show up. It was free. We also stand by the whole idea that people shouldn't have to pay to get fit, right, to go for a walk. But we always encourage people to give a donation. So we would pick like a organization that, you can donate as you please. So that goes and transitions to my next part. November 22nd. So November is National Diabetes Awareness Month. And so on November 22nd, the Run Club and Department of Sports and Park are joining forces to put on a Paint the Town Blue community awareness run for diabetes. And it's going to be great. It's going to be Saturday, November 22nd. It's going to be free to the public. And the proceeds and the beneficiary, luckily, is going to be Patient Assist BI. So we are going to have doctors and healthcare professionals come out and walk with seniors, with whomever, and you can just have that candid conversation. It's going to be called Walk with the Doc. It's going to be more so of a tramp, so it's easier. You can walk, listen to music, get your body moving. So that is going to be really exciting. There's going to be a 5K portion and a 1 mile portion. It's all going to start at Griffith Park. So you can sign up. You'll sign up on runsignup.com. I will share with Tanya the link where everybody can go ahead, but it'll be on social media and on the other media platforms as well. So it would be free. You'll get a t-shirt. We'll have vendors there. You'll get a little warm up, and Miss Tanya will also be speaking about her journeys and all the great things. So it's going to be great. So hopefully you guys can come out. and just get your body moving right before the Thanksgiving holiday. So that's gonna be really, really great. Any questions about that? Anybody thinking about joining? A little walking, a little movement. I know you go ahead and you do some workouts. I always see you. Yeah. Kind of scary. Yeah, I know.
What time on the 22nd?
The 22nd, check-in will start at 6 a.m. Yeah, so it's a morning one.
Maybe our entire Rotary Club will be there.
So when you register, when we send the link, it's gonna be runsignup.com. We're just waiting for some final little tweaks to our flyer, but as soon as we get it done, which we hopefully will get it done today, I will share it with Tanya. She can share it in your group, and then it'll also be on our social media pages. It's called Rock City Run Club, so yeah.
I'm sorry, it's located across from here? You guys work over
So
there?
Our start off point is at Yacht Haven Grand at 6 p.m. on Mondays and Wednesdays.
Oh, Mondays and Wednesdays, everyone can just show up?
Just show up.
Just show up?
6:30? Yeah, really 6:30. I mean, we put 6 o'clock in there, but yeah, 6:30 is when we'll actually start. We try to make sure everybody's there. We have a huge group chat. I can add you to it if you're interested. But yeah, just show up as your best self and do your best. That's all we encourage for everybody. Because everybody just needs a little kickstart, you know?
It's really good.
Jamila's a part of it.
Yeah.
What's your part of it?
I mainly go on Wednesdays though, because Mondays is a little tough.
Yeah.
After working out with Dougie in the morning.
Oh yeah.
But it's a really good group. They're welcoming. All levels are welcome. And right now they've started to incorporate some different things. So we would run to Charlotte Amalia on their truck and do different things.
Job.
You can jog.
So you
No,
walk?
you can jog. You can walk. I do all three. So
Yeah, same. I do all 3.
yeah.
It's all levels are welcome. If you just want to get out and just move your body, that's all what it's about. Yeah. So we can keep ourselves healthy.
Yeah,
all of
for
the
sure.
things, you know.
Make sure we keep everybody updated. You'll get it.
For sure.
Yeah.
Oh, and then
yeah.
everybody go.
Okay, and so
Last but not least.
Last but not least, my newest baby. So everybody in Coast Social Club came about literally in September. It's been an idea that I've been sitting on for quite some time. I, like I said, am a mom of 2, and businesswoman, yeah, a professional, the whole 9. And I realized that women need a space to feel seen, to feel heard, to be safe in a vulnerable times. You know, women, we wear lots of hats, and sometimes we just want to woosah, right? We want to be able to connect with other people where it's not so stuffy in a sense, and just relax and just be, I use the term of just be a girl, right? And everything's like all pink, you can see it's like a very girly touch, but we're really here as this this social club to help women or everybody redefine what wellness looks like for them, right? So we started off with just like a little mixer held at Hotel 1829, which was a great turnout. I only anticipated 30 women to come. That was my max that I was telling them. And I had a total of 90 women show up. And we had...
It was good.
It was a really great time. It was from 5 to... Yeah, it was only supposed to be from 5 to 8. But I was able to extend it to 8:30. And the women that made the connection, the authentic connections, people just being able to be themselves. I had these really cute, like, icebreakers, which was like a spark deck, and you ask a question, you go to a stranger, you ask a question, and then you build, like, you know, just an authentic connection with somebody, whether it be, you know, work related or just, oh, I have this same hobby, or I see you at the grocery store all the time and I never even said hi, but here we are at the same place, and just building the camaraderie, right, amongst women. Women my age these days, you know, it could be a little drama, right? But in this place, we don't believe that. It's a judge-free zone. It's welcome for all women of all ages. And most recently, I had a Pilates and Prosecco class, and it was held at Blackbeard's, and it was a beautiful turnout. I had shades of pink. I didn't anticipate that it was gonna be what it was, but we had 2 Pilates sessions that held in the morning, and then it was followed by a pool social where women could then, after they do the Pilates, they can hang out by the pool, they can socialize. We had different vendors come there, and it was just a lot of fun. And so I'm building, right? My dad always tells me, you build it and they'll come, right? And I have an amazing support system, friends and family that believe in the vision, and now I've got women believing in the vision too, and we're slowly building it. We have our next event coming up next week, actually, by popular demand. Another Pilates and Prosecco and poolside social. And I'm tweaking it every single day. Every event, and I noticed that because we're women, some of us are moms, grandmas, aunties, and sometimes you want to go to an event, but then you just don't have the childcare. So this time I actually was able to secure childcare for free for women to come and enjoy the event, and you don't have to worry about your kid because your kid will be taken care of. And it's going to be actually the UVI dance team that are going to come and teach, oversee the children. All their moms can get that little break for themselves, and so it's great. It's for all women. If you haven't tried Pilates, try it. It's great for the body. We're gonna have tons of more events coming up. So they're for everybody. I tell them all the time, like, I can't think of all the types of events, but I'm always open for suggestions, and people give me great suggestions on what they would like to see for themselves. So it's great. It's just about being the community. I like I said, in a million years, I didn't know that I would be wearing many hats that I do in this capacity, but I'm grateful to do that. The testimonials just from this club itself was kind of tear-jerking, and they're just grateful to be able to have that space. So that's what I do.
Thank you.
I don't know if there's any more questions. I know there's a lot of males in here, but send your wife, send your daughter, send a friend. I don't know, but that's what
Thank you so much.
Yeah,
Thank you.
absolutely. I've covered everything. If you have any questions, ideas, suggestions?
It was nice speaking with you.
It was
Thank you. I
fun
was
meeting
sorry.
you. Yeah, of
It's a
course.
pleasure.
See ya. But yeah, hopefully I didn't ramble too much.